So infectious disease specialists are really, I feel, very critical at this time, trying to help plan in terms of hospital-based procedures and how we're doing testing for our patients, and then really distilling down the medical literature in order to find the best means of testing, the best means of treatment if there are any, so that we can teach our patients, but then also teach other doctors.
So can you talk a little bit about how telemedicine is being used now?
Sure. So telemedicine actually is a very exciting new thing that we're trying to use. Prior to this, I had never really even, I knew what telemedicine was, but I'd never had a telemedicine interaction with a patient. And because of COVID, we've really been trying to roll out more telemedicine so that we decrease our patients' interactions with other patients, with staff, and just really allow the patient not to have to leave their home so that they can follow our local guidelines and our state guidelines to try to shelter in place. So it's really been interesting. I've done numerous telemedicine interviews with patients, and it's really been very nice. I have a lot of patients who come from very far away. We're talking hours and hours of driving in order to see me. And so to be able to provide that service to the patients without them having to leave their homes, it has been, I think, pretty revolutionary for my practice. And I know for a lot of the folks who do primary care, it's also been able to open up a line of communication, especially for elderly people and those who may be immunocompromised, who are very scared to get out of their home. I feel like it's actually been a very, very useful tool that we have.
That's awesome. Can you talk a little bit about testing and why widespread testing may be an answer?
Sure. So widespread testing is definitely the answer in order to help us to better understand who's already been infected, who potentially has had antibodies, and who currently is infected, so that we can better utilize our shelter-in-place guidelines. We can have folks quarantine so that we can really reduce the spread of infections. The interesting thing about this virus is that folks can be, before they show symptoms, can actually be infectious. And so that's a game changer. So if we have somebody that we know has been exposed to somebody, we can do contact tracing and we can tell them, you were exposed to someone who had the coronavirus, you need to be socially isolating, quarantining at home, so that they can then prevent the spread. Even if they don't have symptoms, if they have had an exposure, we want them to try to prevent other folks from being exposed. So testing really is the key.
Can you talk about what the actual test does, like the process of the test and how the results help us be more informed?
So we have two types of tests. We'll talk primarily about the PCR test, which is the test that everybody really has been talking about. So the COVID test is done by taking a swab and putting it into the nostrils. It's actually not a very comfortable procedure, but it really does get into the nostrils to try to get enough sample so that we can run it. So it's taking a sample, and then the sample is put into just a clear tube, and then it's taken to the laboratory where it's run on a specialized machine, so that we have specific platforms that are really developed for this test. And then here at OU Tulsa, we have just recently rolled out that testing. Really the same thing. This is actually in the car testing, so you don't even have to get out of your car. A lot of folks are, very obviously nervous to come out in public right now, and so if they have the ability just to drive up, have the nurse or someone who's doing the test come up in full gear and obtain that sample by reaching into the car, obtaining the sample through the nostrils and then sending it off, that really reduces the risk of that person coming into contact really with any other patients. Right now we're scheduling those on a 10-minute basis, so you'd stay in your car, you have absolutely no contact with anybody else other than the healthcare provider who's obtaining the test.
What is the process if you want to come to the Drivethru testing site? What does that look like for a person who thinks they may have COVID?
So it's actually a very easy procedure. You just need to reach out via phone to OU Tulsa, get in touch with someone who's going to do some screening questions and kind of figure out what your symptoms are, why you think you need to be tested, if you had any high-risk exposures, all of our normal questions. Then they'll get you scheduled. You can even have day of testing. Just need a few hours in order to make your appointment and then proceed here to the testing site so that we can obtain that sample. So it's a really easy, almost painless, other than getting the swab, test that you can get obtained, and then you should have the results fairly soon.
Perfect. So as we're all social isolating and distance, what does this mean for our community long-term and future surges right now?
That is a very hard question to answer. Obviously, we all want this to be over with as soon as possible. Nobody really has the ability to predict the future. Folks who are really, doing tons of modeling and research, epidemiologists who are focusing on the trends right now and then the trends in the future, really are just saying that it really is very dependent on testing, on our graded and kind of tiered response to returning to kind of normal life. And then it's really challenging to know what the future is going to hold. There's the potential that we could have further surges. We're not really sure if the virus is going to kind of go away during the warmer months. That's something that's been discussed, but there's really no way to know right this second. And then if in the fall we'll have a resurgence, it's really very, very challenging to know those answers. I think the thing that the community needs to understand is right now we're all trying to protect ourselves and protect each other, trying to be good neighbors, and that's why we're sheltering in place, following the local, state, obviously following the governor's orders, and then really following the national lead from the CDC, NIH, and other healthcare authorities to try to really do the best job that we can do to get back to normal life, but just realizing that nobody really has all the answers, and so there might be some people have to be flexible. People have to really understand that this is a very rapidly changing situation, and that you're not going to have every single answer today. And if you say something today, it might actually be wrong tomorrow, but that we're all trying to do our best job to protect everybody.
So as an infectious disease expert, I'm sure you've been in a lot of meetings about when we're ending home isolation, and are there talks about what that will look like in the future?
So I have been in a lot of meetings. I have been in like I said, it's really challenging to know exactly. The U.S. government has put out kind of a roadmap, if you will, for a tiered return to normalcy. I think it all is very much based on testing. That's local, state, and U.S.-based testing, so that we really know, like I said earlier, who's been infected, who potentially has developed antibodies, and who's still to be who hasn't had the infection and is at risk of becoming infected. We also have to understand that the test can't tell the future. So if you have a test that's negative today, that doesn't mean that you don't have the ability to become infected if you're exposed to someone who did have the infection. So it's a really rapidly changing situation that we're faced with, but everybody is really trying to put their heads together and come up with the best solution to returning to normalcy.
So there's been a lot of questions and concerns about reopening. In your opinion, do you think that more testing will be part of the new normal as we exit, this first surge?
It's not just my opinion. It's definitely folks who are, like I said, at the local level, at the state level, and at the national level, who are really going to be helping to determine. We definitely are going to be having more testing as we return to normalcy. That's really the only way that we'll be able to return to normalcy, is by, like I was saying, understanding who's already had the infection, who hasn't had the infection, who's at risk, and all those things. So we definitely will have more testing that's completed in the future to help us guide that return.
We just got a question from Jackie on Fox 23, and she's wanting to know if there's any evidence that someone can catch COVID more than once.
Thanks for that question. I don't know that we actually have good data to know if someone can be exposed and actually acquire the virus a second time. There's a lot of data that's coming out of other countries that have been in front of us in terms of having their outbreak, and there's definitely been people who have been PCR positive, so that's doing the nasal test. They've been positive, they have then tested negative, and then their tests have become positive again. We don't know if that's because they were reinfected or if the viral shedding at some times was at a low level so that it didn't become positive, or if the test just was a false negative, or if we don't know exactly what it is. So that is really something that's going to be something that we have to figure out, that scientists have to look at. So I can't tell you right this second, but I'm very hopeful that as we have more information about antibody testing and as we really refine that, that we'll get much more clear information about that.
Perfect. We have a question from Angelica with Channel 8, and she's wanting to know of, besides testing, what other trends have you been seeing, and are you looking for new trends?
So I think as a pediatric infectious disease doctor, I am focused obviously on pediatric patients. I see children. I've been, involved in a lot of the planning for the adult hospital because obviously adults are much more highly affected, unfortunately, in this illness. But definitely the trends that we've been seeing is that we've had, thankfully, fewer and fewer number of adult cases that have needed to be hospitalized. And from a pediatric standpoint, although we probably do have a good number of children who are actually infected but potentially asymptomatically, we have not had we've had very few children who've actually tested positive, which is excellent. So the trend I would think is that we're going to start seeing probably more children who are testing positive who may be asymptomatic, but I would anticipate that we won't have a significant surge in pediatric patients that will be admitted to the hospital, which is great.
Perfect. We just got a question from Kelsey for KFOR in Oklahoma City, and she's wanting to know how people can stay safe when the state reopens.
Thank you for that question. That's something that I've been thinking about a lot as well. And I think really following the guidelines that, again, our local health departments and health authorities are giving us, following the state information and following the CDC guidelines. So that is continuing to have meticulous hand hygiene, continuing to wear a mask in public. As we talked about earlier, the U.S. government has a tiered kind of plan to return to normalcy. And so really following those guidelines, the initial tier is really to limit, for vulnerable populations, to really limit their time, really to be continuing to have social isolation, to continue to wear masks, to continue being in small groups, so nobody should really be in a group that's more than 10 people, and then to limit our travel. So really very similar to what we're doing. And then as we get more testing and as we have more ability to kind of do that contact tracing, so knowing this person's been sick, these are the folks that have been exposed to that person, so that we can then ask those folks to quarantine. As we get more information from that, then the tiers, then we go to tier 2 and then ultimately tier 3 in terms of our return to normalcy.
Do you believe that the expansion of testing is helping to catch these cases sooner?
I definitely do think that as we're getting more and more test sites, and as we have the ability to have folks who are not that symptomatic tested, I do think that we're increasing our number of folks that we're going to be catching. Because again, like I said, from a pediatric standpoint, we have a good number of children that we presume are likely asymptomatically infected, but asymptomatic infection is still an infection, so that doesn't mean that they can't pass it on to someone, a grandma or someone who's otherwise immunocompromised, and then that person could get sick. So as we have more testing, I definitely think that we'll be able to quickly, hopefully more quickly, socially isolate those folks who do have positive tests, so that they're not, unfortunately going out into public and affecting and infecting other people.
Perfect. What has been the most effective so far in helping to treat the symptoms of COVID-19?
So unfortunately, we don't really have any good drugs right now that have been thoroughly and rigorously tested that can be used for COVID-19. At this time, really supportive care is the mainstay. So, initially we were, just like anything, if we don't have medications, if you need to be hospitalized, you're going to be in the ICU or on a general floor, you're going to be getting fluids, you'll be having somebody monitor your temperature and your vital signs. If you have issues where you need to have medications for any of those, blood pressure, if you have fevers, those kind of things, all that's what's considered to be supportive care. If someone needed to be on a ventilator, of course, they would be put on a ventilator to help their breathing, other medications, those kind of things. So although we don't have anything that has any medications that have been thoroughly and rigorously tested in randomized control trials, really supportive care has been the mainstay. And there are trials that are ongoing right now for many of the medications that we've been hearing about in the news. We just really need to have better data before we start using those on a really large scale. I know one thing that we actually have been hearing a little bit more about and have been seeing in the news and then also locally is to use plasma, which has been donated from folks who have actually been infected with COVID-19. They're giving their plasma, and that's been tested and given to patients who've been ill and has actually had some very good initial data that's come out of some of those trials. So that's something that I would anticipate in the future will really be something that we're going to be using. And then obviously we're trying to get a vaccine. You know, scientists across the world are really trying to work as quickly as possible to have vaccine development. I wish that we could just, you know, wave a magic wand and we could have a vaccine, but that's unfortunately not how drugs are developed. That's not how vaccines are developed. And so we really have to try to rigorously test those, because if we're going to be using them on a global scale, we want to make sure that they're safe and effective.
Okay, and this is our last question. So what, as an infectious disease doctor, is the most important thing that you want people to know right now about continuing to stay safe?
So I think the most important thing is listening to our local, our state, and our U.S. government folks who are telling us, you know, socially isolating, you know, how we can return to normalcy, really listening to healthcare authorities, because these folks are, you know, on the front lines every day trying to make these decisions, and they're obviously not made in a vacuum. People are really trying to make the best decisions for global populations. You know, obviously we're trying to make the best decisions for our local Tulsa population, statewide, and then, you know, of course, national. So I really just think that people should, the most important thing is to really heed the warnings. And then, of course, like I said earlier, meticulous hand hygiene. So that's washing your hands, you know, very vigorously for 20 seconds, covering your coughs, wearing a mask in public or some type of face covering in public. And then if you feel ill, stay at home. Obviously, don't be out in public if you absolutely can help it. And then now that we have a significant expansion in test, is to try to reach out to your healthcare provider and get tested, because that's the best way so that we know what our status is so that we can protect everybody else.